Hi everyone, I'm Dale Smith, aka Journo Dale, and we're here to talk about Canadian politics. After the week in Ontario in terms of Doug Ford announcing that he's expanding access to private surgical clinics for certain procedures, there's been a lot of talk about why the federal government isn't doing something about this, and a lot of it is relying on misreadings of what the Canada Health Act does. So what I figured I would do this week is give us a quick primer on what the Canada Health Act actually is and does, so we can get a better idea of just what the federal government is able to do. And the short answer is not a lot. So the Canada Health Act is the conditions by which the federal government gives transfers to the provinces for healthcare. And it's based on 5 criteria. So public administration, comprehensiveness, universality, portability, and accessibility. And there are also a couple of prohibitions in there around what is called extra billing. So that's when a doctor charges a patient for something that he is already billing the province for, or she is billing the province for, at the rate at which the province pays it out. So trying to get more for that service is prohibited. But user fees are allowed, and that's for things like supplies or better qualities of implants or things like that. So those are things that we need to kind of keep in mind when it comes to how the system is playing out currently. So just to quickly go through what is in the Act, it's really not very long. It's 13 whole clauses. Just to, up at the front, purpose of this act. The purpose of this act is to establish criteria and conditions in respect of insured health service and extended healthcare services provided under provincial law because this is provincial jurisdiction, that must be met before a full cash contribution can be made, and that is the federal health transfer. And as for those 5 criteria, public administration is obviously that the system is publicly administered. The comprehensiveness in terms that it must be all medically necessary services. Universality in terms that everyone who is eligible for coverage in the province gets access to it. Portability is the one that's most people don't really get, because we don't have one single national healthcare system. We have 13 separate ones. In each province and territory has their own. So if you were like me, who lives in Ontario, and I go and say visit my family in Alberta, and I have to go to the hospital, what the portability function ensures is that either the Alberta system bills the Ontario system for my treatment, or alternately, I pay for the service in Alberta, and then I come back to Ontario and the Ontario system reimburses me. And either of those methods are permissible under the Act, but it needs to have that ability in there. Obviously, having the province where I'm getting treated bill my home province would be far preferable. But again, this is, as long as there is reimbursement, then that counts under the portability provision. And the final one, of course, accessibility is, again, like universality, ensuring that everyone in the province has access to the system, and that there are uniform terms and conditions and so on in terms of being able to access it. So those are really what the Canada Health Act does. And every election we get parties, usually the NDP, who start talking about adding things into the Canada Health Act to ensure that provinces cover it. But the federal government doesn't get to dictate what provinces cover. They just say that if they want their federal cash transfer, they need to adhere to those principles. And We've seen instances where certain provinces will have, for example, MRI clinics that charge for people to be able to basically skip the queue, and that would tend to run afoul of the provisions within the Act, and will sometimes face clawbacks from the federal government as a result of that. We had an instance in Ontario where there was a private abortion clinic set up in a part of the province which had poor access because the province would only fund them in 3 hospitals, more in a part of the province, in a different part of the province. So what the federal government did was claw back from the health transfer the amount of fees that that private clinic had to charge, because the provincial government should have been funding those services there. But again, you have an issue there where when the Conservatives were in power, they didn't enforce the clawback for that abortion clinic, whereas the Liberals did, again, because of some ideological differences in terms of how they're applying those laws. The current government has decided they want to try and put some regulation within the Canada Health Act to ensure that abortion services are always covered, so that they would face that clawback in the future if that was what was continuing to happen. But again, regulation and legislation can't prevent a future government from repealing those. It will slow them down a little bit, but not by much. So just having them in there is good for clarity, but it's not going to ensure that that's forever going forward. So with all of this in mind, when we're looking at what was announced in Ontario this week, it was expanding these private clinics, which are already in operation. And what they do is they charge the provincial health system to perform the service rather than a hospital doing it. So ostensibly, it does fit within the Canada Health Act rules because you're still getting access and universality and so on. But it's the private clinic as opposed to the hospital that's billing the system. But therein lies the challenge, because if you've got these for-profit clinics, well, where are they getting the profit from? And it's usually with this notion that they found efficiencies, which the hospital hasn't. So that's how they're able to get the profit out of it. But we've also seen issues with things like upselling, and the fact that the provincial health ministry was not regulating or monitoring these clinics. And we had the provincial auditor general released a report last December, which was pretty damning on this particular notion, where she sent secret shoppers to these clinics, and found that some of them were treating the upselling and telling people it was mandatory as opposed to voluntary, and that was where part of those problems came in. And what people are concerned about going forward with these clinics expanding in Ontario. So with all of this in mind, what is it that the federal government is able to do about this? Not a lot. They're not running afoul of the Canada Health Act, so they're not going to be able to really claw back transfers as a result of it. And they can't dictate how provinces run their healthcare systems, because that's provincial jurisdiction, and the Canada Health Act can't just reach into that provincial jurisdiction. So we're left with ideas like Jagmeet Singh saying, well, you need to ensure that a string around future transfers is that there's no more privatization. Well, again, really hard to enforce because provinces need to agree to that, and they're having a hard enough time getting them to agree to things like just basic reporting data so that we know where healthcare dollars are going, and ensuring that they're going to healthcare systems, but actually improving outcomes. And you need to have cross-comparable metrics to see that outcomes are improving, and that's why the data reporting is something that they're really trying to get provinces to commit to. But that's easier said than done, as we've been seeing over the last few months. So there's not a lot that the federal government can do when it comes to haranguing provinces about this kind of expansion of private service. And it's kind of left up to those of us who live in the provinces to pressure our provincial governments to actually do the fixes that the system required. That means things like making sure that your nurses are actually being paid properly and not with a wage cap that is a de facto wage cut. Things like letting doctors hire scribes so that they don't spend all of their time charting and can see more patients that way. Those are things that provincial governments should be doing. BC has finally started to do this. Others are lagging behind in this. But they're not doing it. And Doug Ford has instead gone directly to, well, let's let private clinics deliver more services. And that's part of where that problem is coming in. And this is why I wrote that column about, like the Simpsons reference. Doug Ford has tried nothing and is all out of ideas. There's plenty that he can do within the system to address those backlogs, but he's chosen not to and has gone directly to private delivery. And that's going to create future problems in the system, because if you've got a system where your nurses in the public hospital system aren't being paid properly and you've got for-profit surgical clinics that are offering them more money, you're going to siphon people out of the public system and into these for-profit clinics. And that's going to leave the public system even worse off and create even more backlogs. And that's where a lot of the real concern is going to be. Again, not something that Justin Trudeau or the federal government can really do something about. This needs to be something where people are pressuring the provincial government, and more to the point, not letting the provincial government and any media stenographers try and lay blame on the federal government for that. It's not the federal government's issue. This is a 100% provincial issue. Justin Trudeau cannot do anything about this. This needs to be people pressuring the provincial government to ensure that they're the ones who are properly resourcing the system, who are actually doing the kinds of things that the system needs in order to address the problems they're in. And you can't just wave the Canada Health Act and say, do something, because the Canada Health Act doesn't really say anything about those kinds of things. It's not extra billing, so they can't claw back. So those are things we need to remember as this debate goes forward, and try and bring some facts to the table on that. And that's everything for this week. Join us again next week for some more Canadian politics. I'm Dale Smith. That's at journo_Dale on Twitter. And don't forget to like the video, share, subscribe, and support us on Patreon. Thanks, everyone.